I've always had a really keen interest in biology and in human health. My mother, who's no longer alive, is someone that had diabetes. And I saw that throughout my teenage years and how that really affected her life. And that really probably sparked to me interest, is like, how could I apply something that I was good at to a need that had just become really present in our family, and how could I use that as something I did for my career? What that title means is that I just have a small group that focuses primarily on how to get different pharmaceutical compounds into various parts of the body of interest so that they can take action. I think most people are fairly familiar with the concept of taking a tablet or something like that, and that's what most people's interactions with pharmaceuticals are. I would say there's a lot more that goes on from the point of having a compound that actually is going to help a person and it getting to where it needs to be in the body. That's what the whole area of drug delivery is really about, is how do you get a pharmaceutical to the place that it needs to be. I would say that what I've learned along the way, in many ways, is I learned something about chemical engineering that honestly I didn't understand when I went into it. Most chemical engineering degrees, what they're really teaching you is how to think about things as a system. So don't just think about individual inputs. And this is really taught from probably the very first chemical engineering class people ever take in their collegiate career. And you're putting together mass balances and they're telling you to think about everything that goes in and out of that chemical process. As I got into management areas, you start working with a variety of people, not all of which are engineers, obviously. You work with different departments. And in many ways, they kind of model what they're teaching you in chemical engineering. It's all about the system. You can't just take a chemical engineering group and be successful in pharmaceuticals. You can't just take a chemistry group. You can't take a pharmaceutics group. You can't take a marketing group. You can't take any of them. They're all interconnected in some way. And really, the system has to function really well in order for you to be successful. And I think that chemical engineering is great because it teaches you to think about things as an overall system, and then you're going to actually go work somewhere where it is a huge system and everything is connected together. I think what I would tell my younger self is to try to understand what are the kind of things that make you happy. And I know that may sound funny, what makes you happy, but at a core level, do you enjoy solving just mysterious problems? Do you enjoy seeing things run at a very large scale and just kind of the enormity of it? Just what are the kind of things that you really find enjoyment in, and try to align what you're going to work in with that, because ultimately you will make it a lot further if you enjoy what you're doing.